Making some changes here. Hold on a second. Okay, here we go. Technology is not my thing. Fixing people's bodies, that's my game. Again, hi, my name is Dr. Rappe. I really appreciate everybody coming on tonight. Let's see. Before we get started, we're going to have a little chitty chat. I'm going to ask some questions. Everybody participate. Um, there's a place on Zoom for you to raise your hand when I ask a question. Let's see. I'll start with today is Tuesday. Everybody that knows today's Tuesday, raise your hand. Let's see some hands. There we go. There we go. 4, 5, 6. Good. Participation is important when I ask questions because it helps me understand two things. One, am I getting the point across? And two, have you fallen asleep or not? So hopefully I'm going to keep you energized and enthused the entire time. So we're going to ask a few questions here before we get started. We're waiting for some more participants. I'd just like to ask a couple things. How many people on here right now either know somebody personally or maybe know somebody who knows somebody that actually has been infected with the coronavirus? Anybody? Raise your hand. No hands? 3 people. Okay, 4. Okay, good, good. So we're going to talk about the coronavirus. Now, it's all over the news. It's everywhere. There's all this information. We're being bombarded. I'm going to go through some of the basic information. I'm not here to talk about theories or anything like that, other than it's out there. It's going to be out there for some time. It's not going to go away. We all are going to eventually be in a place where we're going to be infected until they come up with the vaccine, which could take, what I've been reading, it could take 12 months. They're on top of it, so it might go even sooner than that. But still, in the meantime, we're going to want to protect ourselves the best we can. The number one protection that everybody on here tonight has is going to be your immune system. Your immune system is your number one defense against all outside invaders. Regardless of whether you're wearing a mask, whether you've got a hazmat suit on, whether you stay sheltered in your home, your immune system is your number one defense. And we want to make sure that we keep that as powerful and as strong as possible. And we're going to talk about that tonight. So that we're going to go over a lot of things. So how many people on here, let's say, if you've got pre-diabetes or diabetes, raise your hand. Anybody with pre-diabetes, diabetes? How about heart disease? High blood pressure? High cholesterol? Hormone imbalances? There you go. There's some people raising their hand. Hormone imbalances, gut issues. Now, gut issues could be leaky gut syndrome. It could be Crohn's, diverticulitis. It could be irritable bowel syndrome. It could be that you're fluctuating between constipation and diarrhea and you don't know why. Those are gut issues. Really important. If you've got any type of gut issues, you need help immediately. And we'll talk about gut issues and why it's so important that your gut's functioning normally. Let's see what else we got here. Autoimmune. Anybody autoimmune besides me? Autoimmune. Autoimmune is huge because most people that have an autoimmune condition have a weak immune system, right? So I personally specialize in autoimmune conditions. My wife and I both have 2 different types of autoimmunity. And so these things that we're asking about right now is I'm just trying to get a feel for how many people on here have got any of these. Because if you raise your hand for any one or multiple of these, you're in the majority of Americans that have underlying issues that are going to suppress or affect your immune system's ability to protect you. So when we look at what's happening out there right now, as we listen to the news and we listen to the experts, it's the people who are most susceptible are those that have a weak underlying immune system because of some kind of issue. Diabetes, heart disease, high blood pressure, kidney issues. All of these diseases or conditions or issues are going to weaken your immune system. So that's going to make you susceptible. So I'm not as concerned about the coronavirus is out there because there's a flu here every year. I'm more concerned about, do I keep my immune system as strong as possible so that I have the best defense against it if I do get it? And that's really what we're going to be talking about tonight. It looks like we've got some people on here. It's 5:02. Let me get started. For those of you who just came on, let me click to my next slide. The topic tonight really is immunity and inflammation, how underlying chronic inflammation increases your susceptibility to the coronavirus or any virus for that matter. So it's really important to understand. Our goal is to talk about your immunity, but also inflammation, which is really the driver of all disease. And so we want to talk about that at length and how we want to make sure that we try to address the underlying issues. And that's really what I do in my practice. Again, my name is Dr. Rappe. I've been in private practice for 30 years. I graduated from school with my doctorate degree in 1989, and since that time, I've literally traveled all across the country, studying with some of the best functional medicine or the greatest functional medicine doctors in the U.S. and worldwide. I have about 1,500 hours of postgraduate studies. Those studies are in functional medicine, functional endocrinology, functional immunology, functional blood chemistries and metabolic testing, as well as functional nutrition. As you can see on the screen there, I'm board eligible in functional nutrition. I've literally worked in 31 years with tens of thousands of people successfully. It's a passion of mine, and we're open right now. My office is open. I still am adjusting people because there are studies that show getting your spine adjusted does stimulate the immune system. So we are still here and helping people. We do blood labs and food analysis and allergy testing and all of that as well. So we are open and serving the community because we believe that we have a lot to offer to help people get through this crisis that we're in. So my main focus in my practice is functional medicine. And for those of you who know what that is, raise your hand. I want to see how many people know what functional medicine is. There's 2. Good. 3. All right. All right. Good. 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 Now, I have a definition of functional medicine that I think is really simplistic, but it's really directly to the point. So let me share that with you. Functional medicine, for me, is really simple. I call it the what medicine. What medicine. What that means is, what is your underlying cause of your symptoms? That's what I'm interested in. What's the underlying cause of your symptoms? And then I want to resolve that using all natural methods. So let's say you've got gut issues. I want to know what's the underlying cause of the gut issues. If you have GERD, reflux, heartburn, what's the underlying causes of those? And then we want to resolve it using all natural methods. Okay? Cholesterol, what's the underlying cause? Thyroid, what's the underlying cause of your thyroid dysfunction? If you're a diabetic, type 2 diabetic, I know what the underlying cause is. It's insulin resistance. We need to teach you how to reverse and distribute, reverse and break down and eliminate the insulin resistance that's driving the diabetic issues. And we'll talk a little bit more about that. So the what medicine, what is the underlying cause of your symptoms? And then we want to resolve it using all natural methods. Now, I want everybody to be clear on this. I'm not a medical doctor. I'm not here to replace your medical doctor. That's not what we do. Every client that I've worked with in 30 years, I've always been willing to work with their doctor. And in many cases, once I've worked with someone and rebuilt their health and got them healthy as they can possibly be, their doctor takes them off their medications, and then the last thing he says is, who is this guy? What's this guy doing? This is amazing. And the reason they think that way and say that is because it's not what they learned in school. So what I do in functional medicine is completely different than what your medical doctor does. Your medical doctor was trained in school to look at your symptoms and then choose an appropriate drug that was designed to minimize those symptoms. And once you've been put on it, you take it literally for the rest of your life, okay? Now, right now, the medical profession and the medical providers, the nurses, the PAs, the nurse practitioners, the doctors, the hospitals, the support staff are doing an absolute amazing job. And I'm so grateful that I live in the country that I do, because we literally have the greatest healthcare system in the world. We really do. It's a little broken, and we'll talk about that. But right now, they've all stepped up, and they're doing everything they can to keep this pandemic really from taking over our country and killing millions and millions of people. But again, your medical doctor's job is to look at what's your symptoms. High blood pressure. He gives you a pill to lower your blood pressure, and then you take that pill for the rest of your life. that pill will never, ever correct the underlying cause. It's not designed to do that. That's not the way it was designed. It's designed to minimize your symptoms. And so we'll talk more about the pharmaceutical industry, and they've got a vested interest monetarily in taking medications and whatnot, and we'll talk more about that. But again, I practice functional medicine. It's called the what medicine. What is the underlying cause of your symptoms? And then we want to use all natural methods to resolve it, as opposed to what your medical doctor is doing, which is what are your symptoms and what drug can I give you to minimize your symptoms. So I just want everybody to be clear. Again, I'm not a medical doctor. I don't address anyone's medications. I prefer to work with your doctor and work through you and work with your doctor to make changes. And so that's kind of how it works here. So let's look at this. What we're going to be covering tonight in our webinar is going to be straightforward. I'm going to try to go fast. I don't want it to be too long. I know everybody's got a busy life, and I'm really grateful you're here. It says a lot about you and your interest in being as healthy as possible and protecting yourself against the coronavirus. We're going to talk about coronavirus. We're going to talk about America's healthcare crisis, the underlying health conditions that may be weakening your immune system that you're not aware of. In addition to that, how can I take action to boost my immunity and rebuild my health naturally? That's what we do. I've been doing that for 31 years. Okay, it took 31 years for this health crisis that we have today to show up for me to highlight what I do in my office all the time. And so this is what we're going to learn. If you stay on till the very end, there will be a gift certificate or an opportunity to receive a $200 gift from our office. And so please stay on. Again, I'll try to do everything I can to get through the slides. And I'm going to go fast, so pay close attention. If you have questions, we'll answer those along the way. Just for purposes of this, this presentation is for information only. The information is not to substitute for medical advice from your doctor. The information is not meant to prevent, diagnose, treat, or cure any health condition. If you're concerned about your health condition, please discuss it with your medical doctor or go to the ER. If you have any of the symptoms that I'm about to list, by all means, call your doctor and say, I want to be tested. I have these symptoms. I think I should be tested for COVID-19. COVID-19, there it is. We're going to look at signs and symptoms. The at-risk population, everybody on here is probably going to be an at-risk person, just like myself. Flattening the curve, you've heard lots about that over the last few weeks. I have maybe a different opinion on how we should be going about this, but in any case, flattening the curve is the choice that we've taken in this country, the path that we're going to take, and it seems to be helping if you listen to the latest news. I wouldn't recommend too much time on the TV watching the news because it'll make you crazy. Lastly, how to be proactive and take back control of your health. My opinion is each and every one of us as individuals should be in control of our health, not someone else. We as individuals should be in absolute control of our health. That means this: when you go to your doctor, you need to be able to ask every question you possibly can think of that makes you feel comfortable with the process moving forward. Whether it's a drug you're taking, whether it's a surgical procedure, whatever it is. So being educated and knowledgeable is really important, and that helps you be in control of your healthcare, and it's really important. We teach that in our programs. So let's look at COVID. Here are some of the symptoms that we see. Here's COVID-19. This is the one that jumps out at me, runny nose. I had a gentleman in today that's doing a wellness program. He's a diabetic. Wants to lose some weight and get off his drugs and turn his diabetes around. He's type 2. That, by the way, that's something that we do all the time. And he says, oh, I think I had this back in January. He described his symptoms, and his symptoms were over here in this range. Okay, so these are really accurate. This one here, the runny nose. It's very rare to have a runny nose, and it's rare to have diarrhea. Not sure why there's a toilet paper shortage if diarrhea is not as associated with COVID as we would think, but it is. So we're also looking at this. This is really important. This came up right out of Italy. 99% of the people that have died from coronavirus had one or more of the following conditions: heart disease, obesity, high blood pressure, diabetes, kidney disease, and systematic inflammation. Now, that's not the only things they had, but these were the most prevalent. And so if you have anything that's associated with heart disease, okay, diabetes, high blood pressure, obesity, kidney disease, you might have a thyroid dysfunction, your immune system's weak. But this came directly out of Italy's National Institute of Health. We're going to talk about those. Chronic diseases in America, 6 out of 10 adults have chronic disease, 4 out of 10 have 2 or more. So that means the susceptibility of our population is huge. And I'm going to say, I don't know anybody on the talk tonight, but everybody on here probably has at least one underlying issue that makes them more susceptible, and that's why you're on, and that's why we're here to help. If we look at the types of the most common chronic diseases, hypertension, cholesterol, arthritis, heart issues, heart disease, diabetes, kidney disease, heart failure, depression, Alzheimer's, and then lung issues. Pulmonary issues are big, and so it's really important to understand that. Healing the curve, flatten it out. Here's what we've been talking about this in the news for a long time. Social distance. Let me move my little screen out of the way here. Social distancing, avoiding groups, minimizing errands, washing your hands, closing schools, working from home, and now they're talking wearing a mask. I don't know where you guys are from. If you're from here, you have to wear a mask. Okay, you have to wear a mask. I see people now drive around with their masks on. I know I wear it if I go into a store. People are wearing it to get from their house to our office, and some of them will actually wear it in the office. We want to cover what we're going to cover in this webinar. For those of you who maybe have just tuned in, I can't see that on my screen, but if you just tuned in, we're going to cover COVID-19. COVID-19, America's healthcare crisis. We're going to talk about gut health and immunity and inflammation and how to take action to boost your immune system and protect yourself naturally. Your immune system, as I said earlier, is your #1 defense mechanism against any outside invader. Right now, it just happens to be the COVID-19. If you stick around till the end, you'll learn how you can receive a $200 gift from Tri-Functional Wellness Center. So let me ask, why are Americans sick? It's a question that nobody asks. Everybody is just like, okay, we got a sick population. I just showed you a slide that said we have a large population base that have underlying issues. And I have some answers to that. And these are my opinions, but I think they fit. I've been at it for 30 years. So why are Americans sick? Well, the America's healthcare crisis, first and foremost, is driven by big pharma. Big pharma is interested in one thing, it's money. Money, 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 money. In addition to that, health insurance and misleading information. You know, I have clients come to me and wave their card around and say, oh, I have a health insurance card. And I say to them, it's not a health insurance card, it's crisis insurance. That's really what it's good for. It's not health insurance. You have a crisis, it's beneficial to you. But when you have a chronic disease, it's not. We'll talk more about that. So this is what their interests are. Big pharma and the insurance companies interested in money. They're really part of the problem. And it's because the way they approach everything. I mentioned earlier, drugs that you take only minimize your symptoms. They do not correct or address the underlying cause of your symptoms. And that's what Big Pharma has done over the last 50, 60 years. It's really developed drugs for the large portion of the population that will take the drugs for many, many years to increase their bottom line and make a lot of money. Now, let me state this. I am not anti-medicine. Let me share a quick story. My brother, who's a year older than I am, just had a double lung transplant in November of 2019. He'd been waiting 2.5 years to receive lungs. Less than 10% lung capacity when he got the call. He worked every day on a cattle ranch. When he got the call, he called me immediately and said, oh my gosh, they got a set of lungs for me. And I said, what are you doing? He said, I'm feeding the cattle. What do you think I'm doing? I said, well, I'd suggest you go home and shower before you go to the hospital. You don't want to show up with cow manure on your boots. And so the drugs he's taking right now are literally keeping him alive. They're keeping his body, his immune system suppressed so his body doesn't reject his lungs. So there are drugs out there that are good for us, that keep us alive. So I'm not against it. I'm against the idea that we're going to use acute treatments, acute methods to treat acute disease. We're going to use those methods to treat chronic conditions, and that's why we failed miserably. 75% of the $2.7 trillion we spend on healthcare in the United States is spent largely on diseases that are preventable. Any disease that's preventable means this: you had to acquire it. You had to develop it over time. Choices are the biggest reason why we develop disease. If it's preventable, it's also reversible. In addition to that, the acute care system in this country fails to deal with or to treat chronic issues, and that's why we have a largely sick population. And again, that goes back to the pharmaceutical industry that only minimizes symptoms and never really corrects the underlying causes of the chronic issues. Let's look at a health insurance. As I said, health insurance, it's really a crisis care card, but what they do is this: they do not sit people in a classroom and teach them, how do we keep from becoming a diabetic? How do we keep from developing heart disease? How do we keep from developing plaque in our arteries? How do we keep from developing thyroid issues, arthritis, autoimmune conditions? They don't teach us that. If they sat us down and taught us that, there'd be a lot less people out there with chronic disease than there are today. They also don't teach us about why should we eat organic foods. Well, it's really important because the pesticides and the chemicals that are on non-organic foods really disrupt the body's chemistry, physiology, and what really takes place metabolically in the body. And it drives us down a path of metabolic dysfunction, which means you're going to get sick and stay sick. If you want to be healthy, we've got to do some things to really get our body functioning normally again and reestablish normal functionality in our body from a metabolic standpoint. Lastly, they don't pay for us to go to the gym. They should. I should literally get a rebate for the last 30 years because I go to the gym all the time and I exercise, and it's good for us, and it helps to balance our hormones, and it lowers our blood sugar, and it's great mentally for all of the neurotransmitters in our brain and depression. It's just absolutely amazing. And so these are the things they don't pay for. What do they pay for? Well, they pay for your doctor visit, and they pay for your doctor visit to diagnose you with an acute condition and then to treat you with an acute therapy. Acute therapeutics are going to be drugs. In addition to that, if it gets to a certain point, they'll pay for a surgery. To me, it's totally backwards. We should educate people on all this information first so they don't get sick in the first place. Remember what I said earlier, acute care fails to deal with and treat chronic issues. Acute care fails with chronic issues. In addition to that, this is one of my favorite slides. I just got to tell everybody that. The U.S. spends $425 billion a year on pharmaceutical drugs. A lot of money. $425 billion. Man, that's incredible. What's really important is this. The United States only makes up 5% of the world population, but we're taking in 75% of all the drugs on the planet are consumed here in the U.S. So again, in my opinion, we're being over-medicated. In my opinion, we're using drugs to minimize symptoms for chronic issues that we really should be finding out what's the cause and resolving it naturally. Why does the U.S. spend so much money? Why do they spend $425 billion? Again, it's because the U.S. healthcare system uses acute care strategies to treat chronic issues. Let me repeat that. The U.S. healthcare system uses acute care strategies to treat chronic issues. Okay? Now, let's say you're in a car accident, you get your leg cut off, you go to the hospital, and they sew that back on. That's an acute scenario where acute care is going to save your leg. That's what it's going to do. But if I've got a chronic problem in my leg and they just give me drugs, maybe I've got some degeneration in my knee, and they say it's not bad enough for replacement. I might have to walk around on a degenerating knee for 10 years before I get a knee replacement. That's an acute care scenario that's treating a chronic issue. They do the same thing with all the diseases that I mentioned earlier. Let's look at some chronic inflammation information. Harvard Medical School says chronic inflammation plays a central role in some of the most challenging diseases of our time. Chronic inflammation has been linked to, get this, cancer, heart disease, high blood pressure, diabetes, leaky gut syndrome, gut issues, autoimmune disorders, dementia, Alzheimer's. That's right, chronic inflammation has been associated with Alzheimer's. So has what's called type 3 diabetes, meaning that you can develop insulin resistance in your brain, and then you develop type 3 diabetes. That's just to mention a few. There's a huge list. I didn't have space to put it on here. But also, scientific evidence has shown chronic inflammation weakens your immune system, and that makes you susceptible to the coronavirus as well as other seasonal flus. So you've got to stop thinking about, I've got diabetes, I'm taking a pill, I've got high blood pressure, but I'm taking a drug to keep it managed. You've got to understand the drugs many times make us more susceptible because they weaken our immune system, and they're never going to correct the underlying cause. The father of medicine, Hippocrates. Hippocrates said this 2,500 years ago. Absolutely amazing. That's a long time. All disease, let me repeat that, all disease begins in the gut. And I have to agree with them. You know, we followed this knowledge and this understanding and the statement for many, 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 many years until modern medicine came around and started making drugs and saying, oh, let's use drugs and suppress their symptoms and make money. We also want to understand this. Everybody pay close attention here. If you're looking away, if you've gotten distracted, pay attention. 70% of your immune system is housed in your gut. 70%. Think about that. If I have a bad gut, I have a weak immune system, I'm susceptible to all kinds of diseases. That's what he was talking about 2,500 years ago. A healthy gut will also protect us from infections and reduce our susceptibility to coronavirus. So everybody on here should be thinking about, man, I need to make sure that my gut is functioning at optimum capacity. That's what you should be thinking. Leaky gut syndrome, for those who knows what leaky gut is, raise your hand. If you know leaky gut, if you've heard of it, raise your hand. There's 3 people right there. Okay. Oh, good. Excellent. Leaky gut syndrome. 8 out of 10 people have it. And oh, by the way, you don't have to have symptoms. You can have leaky gut syndrome and not have any real obvious symptoms, right? You just think, oh, I'm a little bloated. Oh, I have a little gas. Oh, I had a little diarrhea. No big deal, right? But the key is that it can really wreak havoc. And here's what it is. Here's leaky gut in a nutshell. These cells over here are normal. And oh, by the way, for those of you who don't know this, the lining of your intestine is only 1 cell thick. And its job is to protect us from outside invaders. Okay? It's only 1 cell thick. It has a very important job, and you need to make sure it's functioning at optimum levels. So when these cells are normal, only the smallest micronutrients can fit through these places called the tight junctions. The space that's called the tight junction has a very difficult job. It has to be small enough to keep the bad guys out and big enough to let the good guys in. When we get inflammation in our lining of our intestines, these cells start to split open. That's called leaky gut. See this? Right here is where all the bad guys, the viruses, the gluten, the large particles of food that didn't digest properly, protein sequence change, amino acids that shouldn't go in, everything that's supposed to go in the trap door and into the sewer is now leaking into your bloodstream. It can cause a lot of issues, everything from nutrient malabsorption, autoimmunity is a key, food intolerances, blood-brain barrier breach. That's right. There's all these studies of the brain. These imaging studies that are showing bacteria that shouldn't be in the brain that are in the brain, and they got there through this leaky gut, as well as systemic inflammation. I just have spent time now telling everybody how inflammation drives all disease. So if I have an inflamed gut, I'm going to have inflammation everywhere in my body, and I'm going to be highly susceptible to all of the underlying diseases that minimize my immune system and make me more susceptible to the coronavirus. So we know that a healthy gut means a strong immune system. That means happy, happy, happy. Everybody on here, including myself, my family, we all want to get back to normal. I want to go to the beach and play frisbee and paddleball with my kids. I really, really look forward to that. But we need to know we have to have a healthy gut to have a strong immune system. And remember, 70% of your immune system is housed in your gut. 70%. So before you buy some vitamin C and before you buy some of this or some of that, thinking somehow that's going to protect you, you've got to get your immune system strong. And those are only parts of what you need to do. You can take a lot of different supplements, but if your body is in dysfunction, I don't digest them, I don't absorb them, I'm not utilizing them, they're just wasted and they go out the trap door, they're not doing you any good. We've got to get your body functioning normally so that those things will actually help stimulate and boost your immune system. This is just an article I found that showed stomach acid protects us against outside invaders like infections. Here's some interesting articles. Here's 2 articles. One shows about how proton pump inhibitors, meaning Drugs that you take, here you go, Priceless, it's an over-the-counter to lower your stomach acid for GERD, reflux, and heartburn. There's 15 million Americans taking them, and they actually make us sick. They drive leaky gut syndrome. They don't allow your stomach to break down and absorb the nutrients that you're eating. They're just really bad for us. So my question at this point, and we're getting through it, is what's your medical doctor's solution? Again, I'm not here to beat them up. I just want to know what their solution is. I have a lot of good friends that are medical doctors, and they don't have a solution. They don't have a solution for immunity and inflammation. I asked them, I said, so what are you going to do for somebody for immunity? And they go like, well, I really don't have anything, but I can give them some anti-inflammatories. Just the wrong thing to do, because they reduce the potency and the power and the strength of your immune system. What does your doctor have? What's a solution for chronic underlying issues like the ones you guys have mentioned? People raise their hand that they have diabetes, they have heart disease, blood pressure, cholesterol, all the issues that we talked about. What's their solution? Well, we know, everybody knows, everybody on here could answer this. Their solution is drugs, drugs, and more drugs. It's not their fault. It's not their fault. They're working in a broken system. It's what they were trained in school to do. That's not what my training is. That's what they were trained to do, is to give you drugs. We all know the drugs only minimize your symptoms. If the drugs that they're providing you fix the problem, corrected the underlying cause, you would not have to keep taking it for the rest of your life. And lastly, they don't correct the underlying cause. In many cases, they weaken the immune system. Obesity and heart disease runs rampant in our society. This is pretty amazing to me. Most people aren't aware of this. The American College of Cardiology says about 42% of Americans are obese. That's 140 million people. That's huge. That means every single one of these people is susceptible to the coronavirus, much more so than somebody who is healthy and of a normal weight. And it says right here, the immune system of the obese person is now considered not to have the same infection fighting potential of those of a healthy weight person. So any of your family or friends that are overweight, over the next year or so, until they come up with a vaccine, they're going to be susceptible until they can get their weight under control. Additionally, obesity is also a risk for developing autoimmune. Autoimmune is terrible. It can it can literally attack any tissue in the body. Some of the autoimmune that we're seeing out there, especially for the rheumatology people, we see this in the news. People that are dealing with rheumatoid arthritis, they're taking their drugs away, because those drugs seem to help those individuals who already have COVID-19 and are sick. But lupus, rheumatoid arthritis, psoriatic arthritis, psoriasis, Crohn's, just to name a few, are often managed with biologic agents that reduce the immune system ability to fight infections. If you watch television at all, you don't have to watch for more than a half an hour or so, and there always will be commercials on that are showing drugs to reduce your immune system for something. And then they always have these horrible side effects. You're going to have a bleeding ulcer, hemorrhage in the brain, and blah, blah, blah. All these things that are so much worse than the psoriatic arthritis or the psoriasis or the diabetes. And sometimes they'll even say may cause sudden death. And so you got to remember, sometimes the drug or the cure is worse than the actual underlying issue or disease. Heart disease. Most people don't know this. This is a great fact. It came out. Heart disease is the #1 cause of death in the United States for men and women. Huge. #1 for men and women. Heart disease statistics. In 2017, the statistics showed that one person dies every 37 seconds from heart disease in the United States. Heart disease is completely preventable. We just have to teach people how not to develop it, but we don't. We wait until they get it, and then we manage a chronic disease with acute therapeutics. Research shows 80% of all cardiovascular disease is prevented by reducing inflammation and adopting healthy lifestyle behaviors. American Heart Association. Some diabetic facts for the diabetics out there. If you're not a diabetic, if you know someone who is, this is really important. Type 2 diabetes is completely reversible. Even if they're on drugs. What I hear a lot is diabetics say, oh, my diabetes is managed just fine. And I go, okay, let's look at the side effects of the drugs you're taking. And so they go, well, what does that mean? Well, let me show you. Diabetes and prediabetes is inflammatory. So from an inflammation standpoint, we're going to drive issues like blindness, kidney failure. All right. These are two huge. Diabetes is the #1 cause of blindness and kidney failure. I know you got it under control with the drug. It's being managed. No, it's not. You're dying. You can fix it. It's just about what's the underlying cause and working with someone that does that kind of stuff. Diabetes has tripled since the 1980s and is projected to triple again between now and 2030. So the drugs aren't stopping it. It's continuing to get worse and it's worse and it's worse in the country. This is the one that really is a shocker. Diabetics are 4 times more likely to have a heart attack or a stroke, and it's because of the inflammation. Heart attacks and strokes are typically inflammatory related, and so it's really important to know this. Prediabetes and diabetes means we have increased insulin, which means increased inflammation. And we know through studies that increased inflammation in the body is going to minimize or weaken your immune system. And right now, every single person in this country needs to have the strongest immune system possible so we can get through this pandemic. For those of you who just tuned in, these are all the topics we're going to COVID-19, America's healthcare crisis, inflammation, immunity, and then how to boost your immune system or your immunity and protect yourself naturally. If you stay on till the very end, there will be a $200 gift from Thrive Functional Wellness Center. So please stay with us. Thyroid, any thyroid people out there? You notice my hand is up. You got thyroid. Oh yeah, I got a thyroid issue. I'm dealing with what you're dealing with. Whenever someone comes in to see me for thyroid, I go, what tests your doctor run? TSH, maybe T4, okay? I said, well, there's a lot more. I run 9 different tests. I run 9 tests because I want to see exactly what's going on with your thyroid and all the related organ systems. It doesn't work by itself. You're not a thyroid. You're an entire body. So it's really important to understand that. When I work with thyroid cases, what benefits them is that I have it too. So I know what they're going through. So when we talk and I coach and mentor, they know that they're working with someone who's been through what they've been through. 30 million people in the U.S. have thyroid disorder, and half of those are undiagnosed. Females are 5 times more likely than males. I got nothing to do with that. Don't point at me. 20% of diabetics are going to have thyroid issues, and here's a biggie. Thyroid issues can weaken your immune system. Your thyroid is super important in the body. I'm going to show you a slide right now. All right, let's get past that. Here we go. Here's this. Thyroid supports. Look at everything it supports. Bone metabolism. There it is. Immune system. So if I'm having some dysfunction in my liver, in my gut, in my peripheral cells, and my thyroid's not functioning properly, I'm going to have huge problems everywhere in the body. Brain, nervous system, gastrointestinal function, gallbladder and liver, sex and growth hormones, fat burning, insulin, glucose. There's your diabetic right there. High cholesterol levels, okay? Healthy cholesterol levels. Your levels of cholesterol can fluctuate if your thyroid is dysfunctional, improper stomach acid. 3 types of negative stress. These are the types of stress that pretty much everybody on here is going to be exposed to on a daily basis. Some kind of physical stress. Maybe we overdo it right now. Most people aren't physically stressed. I've had somebody say to me, goes, man, I've been at home for all this time now, and my wife's got me painting the inside of my house. So he's physically stressed. He's really struggling physically. That's going to have a detrimental effect by overdoing it and not getting enough rest and not getting enough sleep and not getting enough sunshine. Yes, you heard me. You've got to get outside and absorb some sunshine. I'm not saying laying there until you're burnt like a crisp, but you've got to get out there and let that sun stimulate your vitamin D production, but also it stimulates mitochondria on a cellular level. Mitochondria are the powerhouse of your body. They're located in every cell, and with the stimulation of proper nutrition, exercise, good sleep, rest and recovery, and some sunshine, you can actually make more mitochondria per cell, and it's really good for us. How about this? Chemical exposures. Everybody's exposed. If you took a shower this morning, chemical exposure. If you washed your hair, brushed your teeth, put on cologne, shaved, washed your clothes, any of those things are going to be chemical exposure, not to mention what's going on outside of our house. So chemicals are everywhere. When we're exposed to chemicals, they're going to affect our body's physiology, our body's chemistry, and our body's metabolic processes, driving us into a metabolic dysfunction. Lastly is emotional, and everybody's experiencing this on a daily basis. We're doing everything we can at our house to be calm. What makes us happy and makes us calm and feel good about each and every day that passes during this terrible, terrible pandemic that we're experiencing is this. If I can just help one person, if I can spend 5 minutes talking to someone, coaching and mentoring them, and helping them lift their spirits, that helps me feel good. It helps me emotionally. But when we've lost our job, we're not sure where our money is going to come from, how we're going to pay our bills, or our kids have lost their job or jobs. All of these things are going to be very stressful emotionally on us. And again, it affects our physiology. It affects our body's chemistry and metabolic processes. And I got to tell you, the first time I walked into the store and saw empty shelves, it was like I was in a movie. It was like being almost like a Stephen King movie where everything was gone. And it really struck me. And I know that it still has an effect today. I know there's plenty of food out there. I know that we're all going to make it if we just share and don't hoard. But the key is this. We want to support each other as much as possible. If you have a friend or a neighbor who lives alone, FaceTime them, Google Face, get on the computer, Zoom them, do whatever you can. One of my nieces in Canada this weekend had a wedding, and they Zoomed it, and it was great. We had a great time, and I spent some time on a FaceTime with my daughter and her boyfriend. They're up in LA, and we just really, really connected, and we need that connection right now. And so please reach out to anybody that needs. If you have a neighbor who's elderly, ask them if they need anything, if you're going to the store. Those things are going to make you feel good, but it's also going to support them and help them feel like they're not alone. Stress is known to suppress your immune system. Really straightforward. It suppresses your immune system, which means you're going to be susceptible to infections like the coronavirus. So we've got to do everything we can to build that immune system. It's like a muscle. You got to build it. We need to exercise it. And that's what we're talking about tonight. So what's your medical doctor's solution again for immunity and inflammation? We know what it is. His solution for chronic underlying issues, it's really straightforward. Drugs, drugs, and drugs. They only minimize your symptoms. They don't correct the underlying cause. And in many cases, they're going to weaken your immune system. The drugs will literally weaken your immune system. So failing to take action and do something different is going to lead to the same outcome. So if you keep doing the same thing over and over and over again, expecting a different outcome, that's what Einstein would say the definition of insanity is. Okay? What I say here is if you want a different outcome, you've got to do something different. And if you're ready to rebuild your health from the inside out, like Hippocrates, we're going to start with the gut and we're going to supercharge your immune system. Freedom to choose. Remember, the choices are the foundation to our health, period. Every disease that every person on here has or underlying issue, from heart disease to diabetes to chronic inflammation, autoimmune, those are all based on choices that you made. I've held many babies in my life, and I hope to hold many, many more, but I've never held a baby with high cholesterol, high blood pressure, heart disease. Never. Those are things that are developed. So remember when I said 80% of heart disease is preventable? This is what we're talking about. It's the choices that you need to make moving forward. So the choices from the past, the present, and the future are really what's going to design the life moving forward. And whether you choose to be healthy and supercharge your immune system, or whether you want to walk around in fear every day for the next year, afraid that you're going to get coronavirus. 3 hours program. This is what we do here. We want to remove all the toxicities first. Then we've got to resolve the underlying causes. And then we want to rebuild the immune system from the gut out. Remember what I said earlier, 70% of the immune system resides in the gut. This takes me back to a lot of what's going on out there. There's a lot of people out there sending emails about, oh, you know, I've got a zinc product or I've got this product. And, you know, anytime a situation like this occurs, there's always somebody out there trying to capitalize on it. I've been doing the same work that I'm talking about right now for 30 years. I've just fine-tuned it to the place that we're at today. So like I said earlier, you can buy a supplement that's not going to help you. If your body is in metabolic dysfunction, your gut's not working, you can't break down and absorb your foods, and you've got these other underlying issues that have really suppressed your immune system, you can take all the supplements you want. You can eat the best nutrition. It's not going to help you. It will not protect you. We've got to remove toxicities, resolve the underlying causes. We've got to rebuild your immune system from the gut out, and we have to do it using all natural methods. This is our program. We call it the 5 pillars of health. We treat the whole person, not just an individual organ system. First, we detox. Detox is a scary word. Ooh, detox. It's not what you think. It's not pills that make you poop a lot. That would be a colon cleanse. Detox is about cleaning out the body, cleansing the body, and then rebuilding the organ system so that they all are functioning at optimum levels. We want to get all those organ systems to work together because that's what makes you healthy and that's what supercharges your immune system. From there, once we've got everything functioning properly, now we've got to eat the best nutrition. That's when that really good nutrition is going to really, really work for us. I can give it to you now, but it's not going to help. We've got to do these in a very specific sequence. From nutrition, we have to do some kind of fitness. Now, I just will admit it. I'm a fitness fanatic. I love to exercise. I have some injuries because I've been at this hard job of mine, rolling people and wrestling people around for 31 years. So I have a few underlying injuries, but I still exercise every day, sometimes twice a day if I feel good. But fitness doesn't have to be a dredge. It doesn't have to be a drag. It doesn't have to be, oh, I don't want to do this. It's got to be fun. What we do in our fitness is we teach you how to maximize your efficiency with the time you're going to spend. What we teach, we require 30 minutes, 3 times a week of very specific exercises, a methodology that's going to stimulate hormone production. It's going to stimulate brain function, meaning it's going to strengthen the prefrontal cortex of the brain, just like your bicep. We're going to strengthen the prefrontal cortex of your brain. It's going to be enlarged, as well as the hippocampus. Those are the areas that are affected by dementia, and we want to push those off as far into the future as possible if that's something that's on the horizon. Fitness, again, it's only 30 minutes. I see a lot of people that come to me that are on a walker, or maybe they can't walk very far, and we get them back in shape, and they start exercising, and they get better and better and better. Before long, they're walking 2 or 3 miles a day, and they're just really, really doing it. But we start slow and build up. You don't have to go to the gym. Right now, the gyms are closed. I'm doing all mine at home in the garage. So we teach everything you need to do. You can do it at home in your garage or in your living room, but you've got to do some fitness. It's going to be great for blood sugar, hormones, and overall mental clarity and attitude. Here's hormones. We test everybody's hormones, men and women, because hormones are really, really important. We're identifying estrogens in women and men. If estrogens are high in women, we want to reduce those using supplementation. Nutrition and fitness are going to help get you into balance, but we want to be very careful if somebody has elevated estrogens or their hormone, basically hormone imbalances. We want to get them back into balance. High estrogen has killed millions and millions of women. Okay, estrogen dominant cancers have killed millions and millions of women. It can affect men as well. So we balance everybody's hormones. We have to do testing first to identify what is it we need to do. Everything we do in the office is scientifically based. When it comes to your nervous system, this is everything from meditation to mindfulness, and again, gut issues. Besides 70% of my immune system in my gut, one of the #1 neurotransmitters associated with depression comes from my gut. It's called serotonin. We see a lot of people that are on depressive drugs. They come in to see us. We clean their gut up. We clean, cleanse, and repair their body. We get all their organ systems functioning. They lose all this weight, and all of a sudden they're like, man, I can't believe how good I feel. And their doctor will eliminate slowly their depressive medications. So these are taught in a curriculum format. We have to teach people. Here's the bottom line. If somebody doesn't teach you, you're not going to understand what to do moving forward and in the future. And this is why the programs out there, and I'll talk just specifically about weight loss, all the weight loss programs out there, for the most part, about 95% of the people that do these programs, they gain every bit of their weight back and more. Because once they stop eating that little box of garbage that's got all these preservatives and additives and toxins in there, once they stop starving themselves with that crap, no one's taught them what they should do to be healthy. No one's fixed their organ systems. No one has got their body functioning normally. No one has eliminated their metabolic dysfunction. So they go back to what they were doing before, and they gained it all back and more. So we teach people, what am I doing? Why am I doing it? And what's my long-term benefit? What's my long-term benefit? When we teach that to people, they fully grasp it and understand what it is. This is where we get the long-term results that we get. And this is why our office is so successful with these type of programs. We also know that it's a step-by-step process. Everybody needs mentoring and coaching. but you've got to have a step-by-step process of how to rebuild your health. You can read a book, but unless you've got mentors and coaches to walk you through this process step by step, you're never going to be successful. Now, my wife is a certified functional medicine coach, and so we also have certified functional medicine coaching here as part of our program. It's part of the reason why we're successful, because we're able to walk people through the process. This is why I do what I do. Look here, well, here I am, Dr. Rappe. I'm a certified functional medicine practitioner. What does that mean? Not patting myself on the back. My ego's not that big. It's pretty simple. I went through a very extensive postgraduate course in functional medicine and became certified. And the reason I did that is because I want to be able to give everything I have to my clients. I want them to know about the latest techniques, the latest research, everything I possibly can. My kids say to me, Dad, when are you going to stop going to school? And I say, what do you mean? You're 61 years old. You should be done with school. And I said, I got to keep learning because I want to make sure I have every tool in my toolkit to help people. Everybody's different and everybody has weaknesses and areas they need help. And I need to make sure that I'm able to help them. So if you're going to go down this path, you're going to want to work with someone who has a background in functional medicine, 31 years, okay? Thousands of clients successfully. And because of my autoimmune condition and my wife's, we literally live the program that we teach people. We literally live the program that we teach people. This is one of our clients.
My name is Jeff.
It's a great story.
I signed up with it a little over a year ago. And before I signed up, I was diabetic. I weighed 290 pounds. I had high blood pressure, no energy. I was up 3-4 times a night. If I was lucky, I was sleeping 3 hours a night. So I was tired all day. I had brain fog bad. My son keeps telling me, like, you're repeating yourself, you're repeating yourself. I would tell him 4 or 5 times the same things. I would go to a job and not realize how I drove there sometimes. And I just noticed every day was getting progressively worse and worse. And even some of my activities, I like the outdoors, I like to fish and hunt. And just going, I couldn't climb hills, I couldn't walk out the time. I was just no energy at all. I had come into the Dr. Rappe for chiropractic and was visiting him for a few weeks. And I ended up, Julie here, sweetheart, she signed me up, told me to come to this seminar and try it. And it was the best thing I've ever done. Listening to Lori and Dr. Rappe speak was genuine from the heart. And you knew they were here for you. So I signed up on September 1st. And 2 months into the program, I really started to notice a difference. I had a little bit more energy, and it was losing a little bit of weight. I just was noticing differences. And the best part about this program, I always have people ask me, like, well, what are you doing? What is it? Well, it's more than what I'm doing. It's the program. It's the testing. It's seeing what's wrong with you, analyzing it, giving you the proper supplements, and not only that, with the moral support. I mean, any questions you can email, they respond, they answer your questions, and it's been great. And 5 months after my 5-month program was over, I went to my doctor, and my doctor basically took me off all my meds. She was astonished. No more diabetic, no more high blood pressure, no more cholesterol, everything cleared up. I also had fatty liver disease, and that was about 3/4 gone. Which when I went back in May is now my liver's normal. It's been such a phenomenal difference. I feel like I'm in my 20s. And I'm just speechless at how wonderful this program works and how I feel. It's been great. And the best part too is sure I've lost all the weight, but it's the energy, it's everything else I've gained with it. And the main knowledge that I've gained is how to look at my body, and I know what I can eat, I know what I can do. Not ignore the little symptoms, whether it's, inflammation or allergic reactions, and reacting to it. And this course taught me all of that. And I highly recommend it to anyone that wants to change their life, whether it's weight loss, whether it's just getting off your meds or anything. I've now it's been just about a year. I've lost 104 pounds. No more diabetic, no more anything. Like I said, my energy level is through the roof. I can go out and get a new driver's license because no one believes it's me in my driver's license.
What an amazing story. Absolutely amazing. And I really honor his doctor because she didn't blow him off and blow me off. She literally contacted us and said, how can we work together? What you're doing there is amazing. It's just not what I do, so I don't know how to help my clients that way. But can I refer to you? And we're like, absolutely. We're open to help anybody. Again, as I said earlier, I'm not anti-medicine. 104 pounds. He's a really good cook too. I'll tell you, he brings us food. So what's my reason? My family is priceless. We're almost done. So I really appreciate everybody for being patient here. Here's a picture of my family. There's my gorgeous wife there in the middle. She's the boss. My daughter on the left and my son on the right. When I was a little boy growing up in Minnesota, my mom got sick when I was 6 years old. She got sick and she was admitted to the hospital. She was in the hospital for a number of months. Now I'm 61 years old, so that was a long time ago. For whatever reason, they wouldn't allow us to visit her in the hospital. So after a couple of months of being in the hospital, she came home for a weekend for a visit for a Saturday. And so my understanding was she's coming home permanently. So we had a picnic for her and everything. And after the picnic, they loaded her in the car and they took her away, which was really, really discouraging. We hadn't been around her for a couple of months, so loving on her and hugging on her. And to this day, I don't know whether she really recognized this. She couldn't see, she couldn't walk, she couldn't talk. She was in a wheelchair. She had just had a brain surgery for a brain cancer. And I didn't know it at the time, but it was the opportunity for her to hug and love her kids one more time because she died 2 weeks later. And so it was a very traumatic event for me. And I believe personally that it was that event in my life that really took me down this path to become the health and wellness expert that I am, and to have the passion to help anybody who's looking to be healthier than they are today. I spent 30 years of my life providing health and wellness to others in my community because I don't want anybody to have to go through what I went through. I promised my wife, we've been married 28 years. I promised my wife when we got married and had kids, I said, our kids will never experience what I went through. I will do anything, regardless of cost, to make sure that you and I remain healthy so that our kids have their parents until they're in their 90s. And so we're working hard on it. So I don't know what your why is, but ours is our family. So let's talk a little bit about the free call. Right now, we're offering a free call to our office, and the free call really is this. Our services are in high demand right now. There's a lot of people out there that are looking for a natural way to boost their immune system. I mentioned it earlier. A lot of people are selling supplements. We want to teach people how to build their immune system for the long haul. This coronavirus is not going away. So a supplement is not going to do it. We've got to fix your body from the inside out and build that immune system up so that you're as strong as possible. This call is going to help us identify what's going on with you. We're going to share, ask you questions. You're going to share with us what's going on or what you're going through. What have you tried in the past? Maybe you've tried lots of different things in the past and you've failed. There's always a reason why. And then we want to also find out how can our practitioners, myself and our staff, our team, help you, okay? We want to also identify if this is the right fit for you. So we're going to go through a plan of action to prep you for your first appointment. If it looks like this is a good fit, what you're looking for, and the people I choose, I don't take everybody. I'm very choosy because I want to work with people who really want to do what they can to get as healthy as possible. We're going to prep you for that first appointment. So what you're going to do is you're going to go to this address here. You may have gotten it already. Lori might have put it into the question and answer section. I can't see that. But you're going to go to the calendar here and you're going to book your appointment. Do it now. Get on the schedule. Let's not hesitate. Get on the schedule. We're going to go through this. If in fact it looks like our office has to offer is a good fit for you, and this is going to work for both of us because I want it to be both for both of us. You know, I want to help people that really want help. And so what we'll do then is we'll move forward with a consultation and an actual meeting with me. And what that'll look like is pretty straightforward. Here's the information. Now is the moment that you can change your life forever. Book your appointment. So once we've done the phone call and identified that what we offer in the office fits for what you're looking for, you'll make an appointment to meet with me. You'll go to our website, download some paperwork. I want to identify everything that's going on with you. You're going to answer all these questions. I need to know as much as I can. If I cannot help you, I'll tell you in advance, I can't help you. There's no charge for that, okay? I just want you to know, if I cannot help you, if I don't believe what we offer in the program or in our office here will work for you, then I'll tell you up front. Honesty and integrity is why I've been here for 31 years. We do not take people on that we absolutely know we're not going to be able to help. So please fill out the paperwork. If you can get some labs, you can email those labs to me so I can look at the labs as well before we meet to go over your paperwork and do your consultation. We're going to, again, identify if this is a good fit. So please get on the line and make that call. Let me see if I can change this here. Here we go here. Let's see, let's see, I don't know how to share the screen. It's not giving it to me. Oh, there we go. There we go. There we go. Okay. So let's do this. Let me answer a couple of questions. I got a few questions here. I've got them written down. You still on? Good. You guys, I'm a little quick with the trigger here. Sorry about that. So a couple questions. Do we take insurance? Your insurance pays for crisis care only. That's what it pays for. This is wellness care. This is an investment you need to make in your future. Again, coronavirus is going to be around for another year. You've got to invest in building your immune system to become as healthy as possible. We have lots of different ways to cover costs of the program if we decide to work together. We have different options and payment plans. I've never turned anybody away that wanted to do a program. We've always figured out a way to make it fit into a budget so it works for you. Number one, that means it's affordable. I've never had anybody leave who couldn't afford a program. I have single moms, single dads, retirees, all that kind of stuff. Do you have to live here? I have people all over the country that I've worked with, people I've never seen before. The only time I've seen them is in a Zoom call like this. So somebody did our program, somebody went home, they said, wow, you look amazing, I feel so good, I'm off my drugs. And they'll say, oh, who is this guy? Next thing you know, we're getting emails, we correspond back and forth, then we get on a phone, we get on a Zoom call, and we do our consultation. So you don't have to be here to walk through our program. Is the food weird? No, the food's not weird. It's food we've been eating for thousands and thousands of years. We just got to pick the right stuff. We got to pick the foods that are going to make us healthy, and we have the foods to get away from that are making us sick. So the food's not weird. Exercise. Yes, we want you to exercise, but you don't have to go to a gym. Like I said, I work out in my garage. I set up a little bench and some weights and whatnot, and I have a little routine. I do foga, which is my word I made up, called functional yoga. Stretching is really important. I do a lot of meditation, a lot of Tai Chi, and so I'm really heavily involved in all those activities. So you don't have to go to a gym. And lastly, again, you don't have to be local. Those are the most common questions that we get. So I'm going to go back to share screen and go, nope, no more share screen. I'm going back to where I was. Okay, I did something here. Hold on, everybody. What did I do? There, see, I told you I wasn't a technology guy. There we go. Okay, guys, look, I really appreciate you being on tonight, and I'm going to say goodbye, but we're going to continue to answer some questions. Thank you very much. God bless.